Hello and welcome. Today we'll be discussing pseudophakia-related complications. Pseudophakia refers to the state of having an artificial lens, or intraocular lens IO, implanted in the eye after cataract surgery. While cataract surgery is generally very successful, complications can sometimes arise following IO implantation. Let's delve into these potential issues, their causes, and how they're managed. The causes of pseudophakia-related complications are varied. Some are directly related to the surgery itself, such as residual lens fragments, IO malposition or dislocation or inflammation. Other complications can arise later due to factors like pre-existing eye conditions, the patient's overall health, or even simply the natural aging process. We'll be exploring these causes in more detail as we go along, highlighting both early and late onset issues. Understanding the pathophysiology is key to grasping these complications. Essentially, many of these issues stem from disruptions in the delicate balance within the eye after IOL implantation. For example, retained lens fragments can trigger chronic inflammation, leading to glaucoma or cystoid macular edema. IOL malposition can distort vision and even damage the eye's structures. And posterior capsule opacification or PCO, the clouding of the membrane behind the lens, is a common reaction that blurs vision. We'll investigate the specific mechanisms behind each complication. While precise numbers vary based on location and surgical techniques, understanding the epidemiology helps put the issue in perspective. Cataract surgery is one of the most frequently performed surgeries globally, and thankfully, complication rates are generally low. However, given the sheer volume of procedures, even small percentages translate to a significant number of individuals experiencing pseudophakia-related problems. Older age, pre-existing eye conditions like glaucoma or diabetic retinopathy, and certain surgical techniques can increase the risk of these complications. The signs and symptoms of pseudophakia-related complications can range from subtle to severe. Blurry vision, glare, halos around lights, eye pain, redness, floaters, and even vision loss are all potential indicators. The specific symptoms will depend on the type and severity of the complication. It's vital for patients to report any new or worsening visual disturbances to their ophthalmologist promptly after cataract surgery. Diagnosing pseudophakia-related complications requires a thorough eye examination. This typically includes assessing visual acuity, checking intraocular pressure, and examining the cornea, iris, and retina using specialized instruments like a slit lamp and ophthalmoscope. Optical coherence tomography or OCT is also frequently used to evaluate the macular and optic nerve. In some cases, ultrasound or other imaging techniques may be necessary to visualize the IO and surrounding structures more clearly. A precise diagnosis guides effective management. While not strictly classifications, pseudophakia-related complications can be broadly grouped based on when they occur early versus late, or by the specific structure affected, such as the cornea, iris, or retina. We can also consider them as mechanical complications related to the IO, inflammatory complications, or those resulting from pre-existing conditions. Grouping them in this way can help organize our understanding. Treatment and management strategies vary depending on the specific complication. Posterior capsule opacification, or PCO, is commonly treated with a YAG laser capsulotomy, which creates an opening in the cloudy capsule to restore clear vision. IO malposition may require surgical repositioning or exchange of the lens. Inflammation is often managed with steroid eye drops. Other complications may require more complex surgical interventions. Prompt and appropriate treatment is crucial to minimize long-term visual impairment. While not always entirely preventable, several measures can help reduce the risk of pseudophakia-related complications. Choosing an experienced surgeon, careful pre-operative evaluation to identify risk factors, meticulous surgical technique, and diligent post-operative care are all essential. Patients should adhere strictly to their prescribed medication regimens and attend all follow-up appointments. Addressing pre-existing eye conditions before surgery can also lower the risk of complications. The prognosis for pseudophakia-related complications is generally good, especially with early diagnosis and appropriate management. Many complications can be effectively treated, restoring good vision and improving quality of life. Ongoing research and advancements in surgical techniques and IOL design continue to improve outcomes and minimize risks. New IOL materials and technologies are constantly being developed, further enhancing the safety and efficacy of cataract surgery. For instance, advancements in femtosecond laser-assisted cataract surgery are showing promise in improving surgical precision and reducing certain complications. Regular eye exams are vital for long-term eye health following cataract surgery.